Hello everyone, my name is Leila. I'm going to talk about the interior design and its importance in clinical practice. So first of all, I would like to share my own experience that I had. I remember once I went to my regular dental office to visit my dentist. When I entered to the office, I thought I went to the wrong place, but it wasn't. They had some renovations and different like decoration and design. To be honest, since I went to walk into the office and I was waiting while I was waiting on the waiting room until I went to the operator room, I was so fascinated because I really enjoy. Even I remember I didn't feel that much pain in that moment because I was so comfortable and I was really impressed by the decoration, by the design, brightness, and colors. I think psychologically also really affected me and enhanced my mood and motivation to stay there, even like to come back again to have my dental service. In that time, I told myself, yeah, dental interior design really works. So for today, the learning objective is the learner will be able to explain the importance of interior design in clinical practice by the end of the session. So briefly talk about interior design and its history. The first interior designers were in ancient India around 1680, and the Greek also believed in beauty and came up with a word, an aesthetic, which means beauty and appearance. And then we try to maintain these aesthetics in our life because they have major impact in our mood and feelings. Interior design also helps to uplift our spirit and effectively optimize our space at home, workplace, and making the best use of our spaces. So for our pre-test, we have a few questions. I would like to just read questions, take note or screenshot. You are going to have some pictures in next slide, which you are going to answer this question based on those pictures. So number one, look at pictures. How will you describe their difference? Have you ever been to one of those styles of dental offices? What is the role of colors in their design? What is their style? And have you ever designed something or somewhere by yourself? Okay, totally you have 2 minutes. And please write your answers like in the chat box or you can say them loud. Your time is up and I'll change the slide in a minute. Okay, and slides for pictures. Okay, good. Thank you for the participation. Okay, in the chat box, yes, modern, old, traditional, yeah, great. So if you look at the pictures from the left to right, so the first one, we can call this style traditional, and the rest can be modern. And of course, they use different colors, and there are a combination of colors of their design. But the colors have in psychology have meaning and personality. Like for example, like in brown color, kind of meaning like sadness, loneliness, or like a white is more brighter and purity. Black color, which you see on the last picture, like in a classical picture on the wall, is represent like power, elegance. Gray also is a symbol of balance. On the third picture, you see like how bright it is, and they use the white for ceiling, for walls, even floor. So the different combination of colors, they convey different messages to people. Okay, in continue, I would like to talk about more about interior design and also answer deeply for those questions. There are 7 elements of interior design, and this is like a cooking recipe, and these are the ingredients. It's a space, line, which vertical, horizontal line. They can come from like window, doors, staircase. Form is a shape of room, light, pattern, which also is important, comes from like area rug, wallpaper, or soft, comfortable furniture. Color and texture count because how it feels or how it looks, and also every like part of the furniture or object in the room can contribute to the selection of the texture. And what are some pros and cons of interior design? It reflects your personal taste. Of course, the way like how you design your room, your office room, your home, this is a reflection of your own ideas and values. And of course, creates comfort and sets a mood. As we talked in the color selection, they have meaning, they have personality. For example, sky blue color can represent peaceful area, or bright yellowish can represent like sunshine, like that. And they can be also overwhelming when the space is like so much crowded with too many objects and furniture. With less space can be expensive and make it difficult to resale, because interior design is highly personal and make it challenging to sell others. How important is good design in clinical practice? Having well-designed office create productivity, functionality, creative practice growth. And dental offices design will reflect owners' personal values. Patient will make judgment about practice based on what they see around them. And of course, design must be with the in line with medical field regulation. Functional balance should be between patient comfort, clinical function, technology, ergonomic design, and infection control policies. And client will assess the clinical skills and quality of work based on their experience and feeling they have in their physical space. For example, think about one of your favorite dining restaurant. Like they may have amazing like cooking skills. They can represent like, you know, the beautiful plate, but what is going to complete them is the overall, the atmosphere, and also the physical space of that like restaurant. Similarly, in dentistry also, decor, design, like brightness, colors, also going to complete the whole process. And clients is going to assess this clinical skills of healthcare professionals based on the physical aspect of that atmosphere. Okay, interior design, healthcare. For getting to the more deep into how to understand the interior design's role in healthcare, just please watch this short video. You just click on it, and this is for you. Okay, for our post test, which is time to test your knowledge, please just list 3 reasons why interior design in the clinical practice is important. Write down your answers. Again, you can share it in the chat box or just say it loud. Your minute is up. Okay. So why interior design is important? Because it can create comfortable, productive spaces to satisfy clients, improve color effect, size, and pattern. Also, clinical practice combined with good interior design are more successful because they create more comfortable and satisfying atmosphere for clients. And of course, enhance mood and spirit of clients. And especially it can affect their motivation to comply with treatment plan, even to change their behavior effectively. Okay, I hope this information was so useful for you and you enjoyed the session. Please feel free, if you have any question, write them down in the chat box or just say it loud. If not, I hope you can use this knowledge today in your future practice if you would like to practice independently one day. And good luck. Go have a coffee and enjoy your day. Perfect. And don't hesitate to make even any small changes in your room in color, light, texture, or pattern. It's going to affect more. Thank you. Have a good day. Any questions again? No. Bye-bye. Thanks. Okay, stop.